We all are aware that RINPAS and NIMHANS already started their admission process in M.Phil in Clinical Psychology. So today we are here. If you are having any doubt, any query, so we can discuss on it. As well as I also came here with 10 MCQs. You can consider them as a model questions. We can discuss on those. And whenever we are discussing on those questions, if you are having any doubt, any dilemma related to your entrance preparation, related to anything related to M.Phil in Clinical Psychology, PsyD or psychology itself, we can discuss on them. So let's begin. As you can see, these are the question answer session, but at the same time, we will also discuss at least 10 questions. You can consider them as a model questions, right? Let's move. Here you can see the first question is, in the drive reduction theory that is given by Hull, HSR stand for. We can consider this question is easy. You can see here I have already added this marks here, easy. You are having 4 options: excitatory potential, drive reduction, habit strength, and stimulus intensity. If you know the answer, you can mention your answer in comment box. That will help me understand your understanding and learning the concept from this particular session. And whenever we are discussing these questions, you can put your doubt, you can put your queries. If you are having any confusion related to preparation, psychology entrance preparation, you can mention in chat box. Here we have to identify HSR, that means which term we can relate to HSR. HSR. We all are aware when we talk about excitatory potential, this is ESR. Excitatory potential is known as ESR. This S is stimulus and this R is response. So E is excitatory potential. When we talk about drive reduction, we are presenting them by the symbol D. When we talking about habit strength, then this will be related to habit strength. That means HSR. Again, this is stimulus, R is response, and V is stimulus intensity. So now we are aware the correct answer is habit strength. Fine? Okay. Second, you can find here which theory states that people try to regulate their emotions to minimize the distress caused by a situation. This will be moderate kind of question you can find here. Options are problem focused coping, B Hans-Selye approach, C cognitive appraisal, and D emotion focused coping. And correct answer will be, you can guess. If you know the right answer, you can mention in chat box. Correct answer is D, emotion focused coping. The theory, this particular theory states, or this particular coping mechanism, emotion focused coping, mentioning people try to regulate their emotions to minimize the distress that is caused by situation. We call them emotion focused coping. We also have to understand that in emotion focused coping, individual manage the emotional distress, we can say. Individual manage emotional distress that created by a stressful situation rather than directly addressing the problem itself. Like, it involves regulating emotion, such as seeking social support. We are finding social support. We are helping our client to develop social support. Reframing the situation. Individual trying to engage in relaxation techniques. So all these things we are using in emotional focused coping. Correct answer will be D. This is problem focused coping. Here we are directly involved into the problem, right? We are focusing on the problem. We are trying to solve the problem, not the situation. When we talk about Hans-Selye approach, we all are aware this is related to stress, but Hans-Selye approach mentioning there are different level of stress, different stages of stress, as well as cognitive appraisal is helpful to understand stress. There will be primary appraisal, there will be secondary appraisal, how we are interpreting that stress, we are having coping mechanism or not. So these kind of explanation, we all are aware. If you think that I am not well versed with any concept, you can also mention them in chat box. So next time, whenever I will make video, I will keep your suggestions. If you are having any doubt, I will keep those particular pointers in my head. So we will try to make videos on those. So correct answer is emotion focused coping. Now we can move ahead. Third question I added here. Now you can see, which neurotransmitter is primarily involved in regulating mood, appetite and sleep? We can consider this particular question easy because we all are aware. Maximum individual will be aware what is the function of dopamine, serotonin, GABA, glutamate, but we can take a revision. Which neurotransmitter is primarily involved in regulating mood, appetite and sleep? Question will consider as easy. Your options are dopamine, serotonin, GABA, glutamate. One thing we all have to keep in mind, whenever you are participating in this session, whenever I am conducting session, the main thing is participation. No matter you know this, you are doing mistake, participate in this kind of session, because the main motto of this kind of session is learning. No matter where we are, we know this thing or right, we are aware about those, no matter where we stand, but we all are here to learn. I'm also here to learn something, right, from you. Whenever you are asking question, mentioning doubt, so I'm also getting motivation, I also feel happy. So this is the thing. So no matter you know it, you don't know it, that's completely okay. So these options we are having: dopamine, serotonin, GABA and glutamate. And correct answer is serotonin. This will be the right answer. When we talk about neurotransmitter, when we talk about serotonin, they are primarily involved in regulating mood, appetite and sleep. Serotonin is a kind of neurotransmitter that play a crucial role in regulating mood, emotional well-being, sleep patterns, as well as they are also involved in appetite. It is known as feel-good neurotransmitter because it influences feeling of happiness and emotional stability. Now, if you are confused that why dopamine will not be the correct answer, because dopamine is also connected to mood, that is also connected to so many functions that is listed here, then why dopamine we are not choosing? So dopamine is primarily involved in motivation, reward and pleasure. They are also responsible for motor control, but dopamine is not the primary neurotransmitter for mood, appetite and sleep regulation. That's why dopamine will not be the right answer. When we talk about GABA, GABA is an inhibitory neurotransmitter that helping individual to reduce neuronal excitability, right? And they're promoting relaxation, they're reducing anxiety, but that is not also specifically related to mood, appetite or sleep. When we talk about glutamate, glutamate is primary excitatory neurotransmitter in the brain that involved in learning and memory. So whenever we are looking into all these options, then we can identify that serotonin is the closest options that we are having in this question. So we can say that is the right answer. One thing that we have to keep in mind, whenever we are going to participate in any entrance exams, we think there will be very difficult kind of questions, there will be some kind of questions that will be very difficult, that will be difficult to answer, but no, that is a myth. In any entrances, you can find all kind of questions will be there. Some questions will be easy, some question will be moderately difficult and some question will be difficult, no doubt about it, right? But there will be all kind of questions. So these kind of questions will be there. You will find these kind of questions over there, right? So you are replying in chat box. So I would like to take your name. I feel really happy whenever you are participating. Rigging wala, good afternoon, good afternoon. Mystery, you are mentioning responses. Seema, hello, right? Seema, nice to see you here. Great, you are participating. Jaya, great. Mystery Universe, Arjun, great to see you here. Andelia, nice to see you here, right? I hope, right, you are liking this session, and I'm glad we are interacting here. Attitude, great to see you here. Noha, Jaya, Seba. So you all are participating, and if you are having any doubt, any individual having any doubt related to entrance preparation, you can mention here. I'm moving ahead. Third question you can see. Fourth question you can see. I have added this one. Deepa is trying to lose weight before her boxing match. She is having a difficult time denying the impulse to stop at fast food restaurant after her workout. According to Freud, which part of her personality is responsible for this impulse? This question will consider as easy. And your options are id, latent ego, ego, superego. If you are aware, then correct answer will be id. Id typically works on pleasure principle, right? So id will be right answer. Now I'm having one question for you. Just try to add what is latent ego in the chat box, right? If you know what is the latent ego, you can mention in comment box. If you don't know, you can mention over there. So we'll try to explain, we'll try to make video on this particular concept, right? Moving ahead. Question number 5. The flying effect refers to, this is moderate kind of question, the decline in average IQ score over time. The decline in average IQ score over time. Option B, the stability of IQ score across cultures. Option C, the rise in average IQ score over time. D, the impact of socio-economic factor on IQ score. I hope you will be aware about the Flynn and Flynn effect. Flynn was a psychologist from New Zealand, and they are having great contribution in so many areas of education, including psychology. First of all, correct answer will be C, the rise in average IQ scores over time. The Flynn effect is observed increase in average IQ over generation, and there are so many things that we can discuss sometime. If you know why they said it, you can mention in comment box, right? But one thing that will be important for exam, they mentioned that 3 IQ point will increase in 1 decade. That means in every 10 years, 3 IQ points is going to increase, right? So option C will be the right answer. The rise in average IQ score, right, over time. Question number 6. Which symbol is used to indicate unusual detail in Rorschach scoring criteria based on Exner system of scoring? That will be the moderate kind of, right, question. Options are D, option B, UD, option C, DD, and option D, VG. You can choose your responses. Okay, I'm getting your response. Okay, Seema, you are mentioning it. Okay, Arjun, attitude mentioning latent ego is impulses that are hidden beneath consciousness, manifest as dream, sleep of tongue, etc. Yes, you are correct. Mystery universe, you are mentioning UD. Subhangi, you are mentioning C. C is DD. Attitude, you are mentioning UD. And Seema, you are mentioning C. That is DD, right? Great to see your responses and great to see your comment, right? Keep learning. Basically, why we are here, right? We all are eager to learn, no matter where we are, what kind of specialization we did. We always need to be around the community where we can learn something, right? So we always try to deliver such content where you can learn, we can explore, we can discuss. If you're having any doubt, any queries, we are having, right, people, they are doing effort rigorously to help you, to provide you the information. So all these things are necessary, right? And I'm glad that you are mentioning your responses here. Correct answer will be, as you are mentioning, is C, DD. This is the correct answer. This is the correct response. Now what is D? So D is connected to common detail. D is connected to common detail. I'm talking about this according to Exner criteria. So Exner comprehensive system for scoring the Rorschach ink blot test is one of the popular system that we are having. There are so many systems, but Exner is one of the popular. According to Exner, DD is connected to unusual detail. So in Exner comprehensive system, D is common detail and UD is not a standard symbol in Exner system, right? This is not a standard symbol in Exner system. DD, as I already told you, that is unusual detail, and VG is vague response. Vague response. Vague response. Response. So D is common detail. UD is not a standard symbol in Exner system. DD is unusual detail. VG is vague responses. So correct answer will be DD. Seventh, you can see which type of therapy encourages patients to find solution to their own problems. This also we can consider them easy, and I don't think we have to explain it. Options are client-centered, modified stimulus, psychoanalysis, behavioral adaptation, and correct answer is client-centered therapy. A is the right answer, right? This particular theory, or we can say the type of therapy that encourages patients to find solution of their own problem is client-centered therapy. So we are helping our client to find solution of their own problem by itself, by themselves. Right? That is client-centered therapy. That will be the right answer. Question number 8. A tendency in which visual elements which are closer in time and space are grouped together is called. That is also easy. We can consider them easy question. Your options are similarity, closure, common fate, and proximity. And the correct answer will be proximity. D is the right answer. A tendency in which visual elements which are closer in time and space. Like we can take example, when two objects will be closer relatively, we can consider them group. Like you can see, this is horizontal lines, right? I'm making, this is the first horizontal line that I draw. Now I am drawing another horizontal line. Now you can see another horizontal line, then third horizontal line, third horizontal line, fourth horizontal line. But now it will be very difficult to consider them horizontal line. Now you will consider them vertical one. Now if I am asking you, how many lines we are having? So 3 lines. Agar मैं पूछूं which lines you are having, you can say this is the line 1, this is the group 1, this is the group 2, and this is the group 3. And why we are able to perceive them as a group? Just because of proximity, just because of nearness and closeness. So D is the right answer. Question number 9. The brain's ability to recognize in response to damage and new experiences is called. And your options are neurogenesis, B. synaptic pruning, C. neuroplasticity, and D. homeostasis. And correct answer is C. Correct answer is C, that is neuroplasticity. Neuroplasticity is also known as brain plasticity. Whenever you are going to read content, then sometime neuroplasticity, sometime brain plasticity you can find. So neuroplasticity and brain plasticity refers to the brain's ability to form new neural connections when certain area will be damaged. Whenever we are learning or whenever we are getting new experiences. So this process allows the brain to adapt changes in environment, recover from injury and improve functioning over time. So correct answer will be neuroplasticity. This is the right answer. This is the 10th question, number 10th, and this is the last question that we are discussing. How many clusters are personality disorders divided into? How many clusters we are having in personality disorder? Question will consider easy. So correct answer will be A. Correct answer will be A. Why? Because there are three clusters. Cluster A, cluster A, cluster B, cluster C. And whenever we are talking about these three clusters, they are divided on the basis of group of symptoms. When we are talking about cluster A, that is based on odd or eccentric behaviors like paranoid personality disorder, schizoid personality disorder, that will be based on odd or eccentric behavior, that is part of cluster A. Cluster B is based on dramatic, emotional or erratic behavior like borderline personality disorder, narcissistic personality disorder, and that will be the part of cluster B. Cluster C is based on anxious or fearful behavior like avoidant personality disorder, dependent personality disorder, right? That will be part of cluster C. So you can see A, B, C. Whenever you will flip DSM pages, then you can find one more other types, right? So other type means they are not fitting in any cluster. That's why we can say option A is the right answer. 3 will be right answer. So 3, we are having 3 cluster in personality disorders, right? So I have added these questions, and yes, gratitude you are mentioning. Okay, responses. Ringing wala mentioning happy Holi sir in advance. Same to you, happy Holi to all of you, right? Yeah, great to see your responses. If you're having any other doubt, no matter I'm here live or not, if you're having any doubt, you can reach to us, you can contact to us on our student helpline number, as well as you can mail us. Our team will be very happy to help you out. That's all for today, right? Hopefully you are doing well with your entrance preparation, and your full potential, your full capacity going there. You are putting your almost energy in your preparation, and we all are aware, and I already presented here that RINPAS and NIMHANS already announced their form, and they begin with their admission process. So this is the right time. If any individual thinking to move with this profession, so just start your preparation, because right now we are having 2 forms. Within few months, all other universities will release their form. So you can start your preparation, begin your preparation now. If you're having any doubt, any query, you can contact to our team. Bye. Take care.